challenge month, week 1, day 2, we're going to be going over structures and also common movement problems related to the knees. Now, I'm not going to go super scientific with this. I don't want to treat this like a college course, if we will, but I'm going to go into a few structures so you see everything and now how actually your body moves, 1, and then 2, how everything correlates with one another and how there's so many different structures involved. So I have a knee model here. This is the front, back, again, tibia, fibula. So inside, outside. And as the knee flexes, it allows glide on this blue thing right here, the meniscus, and then also allows the kneecap to come and track properly. So anytime you move your knee out, you want to be able to make sure that the kneecap is moving properly, because if that gets jammed off to the side, that's going to put more tension on the outside portion of the meniscus, thus cause overlying muscle tightness from there. So between internal and external rotation, that's also why we assess that in the beginning. Now let's revert over to the images on the screen here. With that, we have 2 awesome, lovely knees. Obviously the bones that we see there on the back side, there's ACL, let's do this here, ACL, PCL, and there's also some deep structures around the side, like especially the popliteus, which controls locking and unlocking the knee. Also a little bit of internal rotation or medial rotation, if we will. As we add on more structures from here, there's going to be more of a membrane, and we keep adding more. Then there's the fibrous layers for the capsule itself. So be able to make sure that we can move everything more fluently. We have to start there first, and then the bursas come in, other ligaments. There's a fat pad in there too. Let me scroll out here. So that's just a lot of the connective tissue itself. We can add a couple more layers on with some more of the bursas on the top, bottom. And usually if you have a large amount of swelling from acute injuries, usually you get inflammation in the bursa, or the bursa sac fills up. And then for me, for example, I've had pitting edema all the way down my leg, or increased swelling all the way down, and that just can get removed by the needle extraction on that side of things. It's not too common, but there's other ways that you can go about it as well. Now let's add on some muscles so you guys have a good idea. So there's a lot of deep structures and a lot of deep layers, but the first line of communication is to the deeper structures first, especially the joint capsule, especially relating to the meniscus, the ligaments and tendons as well. And we now know how to train ligaments and tendons different than muscles, different than joints, and each one has to be trained in a different way. In terms of ligaments and tendons, usually you can bleed the energy of a muscle contraction via isometrics at a lengthened state. So when the leg is completely straight, squeeze all the muscles and that energy bleeds into those tissues. But it also depends on what tissues you want to impact as well. So like if your knee is completely bent, that then bleeds more energy into like the popliteus and some of the other structures on the backside. Now let me zone out here so you can see a lot of the muscles from either the hamstrings, they go from the pelvis up top, and then even a little bit below and attaching below the knee. You can see this also on the front side. Let me add a few more layers here. So we got the quads go from the pelvis to the kneecap to the below the knee. The sartorius right up here, which then goes pelvis across the whole knee plane itself, attaches below the knee. So that's why we have to look at structures top down, but also bottom up. As we go through, let's take a look at the calves now. And as you can see, some of them, they go from the heel bone via tendon, and then goes and attaches as the gastroc, or a lot of the soleus underneath it, then goes to the bottom of the knee, and also a little bit on top in terms of the femur itself. Now everything is made by evolving to where we know thus far. Our structures if you go back and look at some of the other literature in terms of where our structures were at thousands and thousands of years ago, we just developed the popliteus muscle because that used to be a tendon to where we weren't able to even rotate the knees. And then we forced compensation in terms of the hips, the ankles. We often walked outside, kind of like a duck in a certain way. But a lot of it was made from our survival and being able to stand upright and view the horizon. But you look at other animals and mammals, and everyone has its advantages and disadvantages. In terms of evolution, not all things we evolve into is necessarily good for us moving forward, but it's just what we had to come to moving forward from there. So I add a few more layers so you guys have a good idea, but the main thing I wanted to show you guys today is there's a lot of deep tissues and there's a lot of overlying muscles and tissues, and they all interact with one another, and how the nervous system attaches to everything. It's really, really important to take everything into consideration in terms of how you heal the knees. Usually the problems come from the hips or ankles, so you have to start with both of those together. But obviously static, or if you were to assess yourself just without moving, that's completely different than assessing how your body moves as well. So we're going to get into another video we have here off to the side. Let me just make this a little smaller here. So with this, we're going to kind of go slow. Now for the first one, I want you to pay attention to how the knees are coming inwards. For most people, when that happens, they usually have flat feet and there's no arch, which leads to compensation inside. And then that pulls on the IT band, some hamstrings, the quads in the back as well. So everything will influence one another. That's why we want to make sure the knees is on are in line with the hips, and then also in line with the ankles as well. So just so you can watch that compensating patterns. There's also other ways you can look about this in terms of the lateral view or a view from the side. But just so you guys have a good idea in terms of, let's go back to this one here. That's going to force a lot of tension on the inside of the knees. And then this one's going to cause a lot of tension in a couple different places. Maybe there's knee pain on the backside, chronic hamstring tightness, pain in the feet, flat-footed. The feet are coming outwards, so that's putting more tension on the glute max and the hips in the back. Usually with this, there's a weaker core. So there's a bunch of different things that you have to address along the way in order to influence change long-term. It's kind of like a Conor McGregor walk with that. Now, as we go into this next one, if you have a limp with that, if you end up moving one of your hips, or if your hip doesn't move independently from your pelvis, which doesn't move independently from your core or bottom pipe and rib cage, it'll lead compensations usually to the other side, and then it can zigzag back up from here. So let me rewind this here. And then that can affect all the other structures. The next one we have is the whole foot is turned inward, the knee is turned inward, and it's putting a lot of pressure on the front of the hip. Usually you get this with sharp pain in the front of the hip, popping hips, pain in the inside of the knees. So with that, you would also want to address the hips and ankles as well. So just keeping track of all these things. If you notice anything, I would probably recommend taking a video of yourself just walking, not even thinking, and see if there's any small things that you notice. If you're in pain, obviously you're going to see problems with that, but paying attention, making note of that is the first step. So that is our video for today. Please leave comments below if you have any questions with that. I know we didn't get into a lot of stuff, but I want you to give a brief overview in terms of a couple things I want you to pay attention to in terms of walking, but how the deeper structures are first to communicate to the nervous system and how that affects everything overlying. Very, very important from there. See you on the next one.